This video is on antibiotics. We will examine the main classes of antibiotics and link their mechanism of action to uses. We will also explain especially important side effects to keep in mind. The most common and well-known class is penicillin, and they include drugs such as amoxicillin, ampicillin, and tazobactam. More accurately, the class is called beta-lactam drugs. And this is because it inhibits cell wall peptidoglycan synthesis through inhibiting beta-lactam. However, over time, bacteria may develop resistance to this through the action of beta-lactamase. Thankfully, beta-lactamase can be inhibited through antibiotics such as tazobactam and clavonic acid. Penicillin is used to treat primarily gram-positive bacteria, such as Staphylococcus and Streptococcus, that can cause a range of infections including pneumonia, sore throats, and skin infections, which is specifically treated with flucloxacillin. The next class is Cathartosporins, and they have the same mechanism of action as penicillin. There are different generations that are highlighted here. It is important to consider how it's evolved, with first generations primarily targeting gram-positive and some gram-negative bacteria. Second generation having a great impact on gram-negative and some gram-positive. Third generation focuses on gram-negative, and fourth generation can be used in severe infections. You must note that this class is contraindicated in breastfeeding. Notably, these antibiotics inhibit cell wall synthesis, so cannot be used against bacteria without a cell wall, unlike the antibiotics we will now discuss. So fluoroquinolones such as ciprofloxacin inhibit DNA toposomerases, so prevent the unwinding of supercoils to inhibit DNA and RNA synthesis. They can be used against gram-positive and gram-negative bacteria, and importantly against non-penicillinase bacteria, such as Pseudomonas, Enterobacter, Mycobacterium, TB, and E. coli, that are not killed by penicillins. Importantly, they can cause long QT syndromes leading to ventricular fibrillation. Macrolides such as azithromycin and erythromycin binds to the 50S ribosomal subunit to inhibit protein synthesis. It is used as a broad-spectrum antibiotic, working against gram-positive and gram-negative as well as atypicals such as chlamydia and mycoplasma, as well as protozoa, interestingly. Also, tetracyclines such as doxycyclines inhibit the ribosomal subunit, but the 30S subunit to inhibit protein synthesis. It is a broad-spectrum antibiotic, so against both gram-positive and gram-negative, as well as atypicals such as chlamydia, mycoplasma, and protozoa. Finally, we will look at immunoglycosides such as gentamicin. They have the same mechanisms of action as tetracyclines. It is used against gram-negative organisms, Pseudomonas, E. coli, and Klebsiella. It is important to understand the side effects and monitoring of gentamicin through checking UECs. Gentamicin causes irreversible ototoxicity due to a loss of sensory hair cells in the cochlear and vestibular apparatus. It causes reversible nephrotoxicity, as it affects the proximal convoluted tubule and causes a tubular necrosis. Monitoring is done if UECs are fluctuating or it is planned to be given for longer than 48 hours. Thank you for watching. If you learned something, please tell a friend who may also find it useful.